From Fox 5 News, this is Good Day New York.
All right, so we've been telling you that February is Heart Health Month, and most people associate heart attacks with older, perhaps obese, out-of-shape men and women, but that is not always the case.
Yeah, and this morning we are joined by a heart attack survivor, 35-year-old young, healthy woman, Christine Fumara. Back in December, and just 4 months after giving birth to her second child and then returning to her demanding job, she experienced what she thought was anxiety.
After being rushed to the ER, she would learn that she was having a so-called SCAD heart attack. Her life flashed before her eyes, and after 2-hour surgery and 4 stents in her heart, she is here this morning. Kristen, she's spreading awareness about what would happen, and she's joined by Dr. Nieca Goldberg. She is a cardiologist from NYU Langone and also the author of The Complete Guide to Women's Health. Nice to have you both here.
Thank you.
All right, Kristen, tell us your story, because you had just given birth to a baby, basically, when this happened.
Yeah, I was at work in a meeting, and I started feeling chest pains and, you know, a little worrisome. And at first I thought it was just anxiety, and I excused myself from my meeting and walked outside. And the second I hit that cold air, the pain got worse and shot through my back, and then my arm started to go numb. And, you know, at that time, my sister, she's a pediatric nurse practitioner, and I remember her always lecturing my family members of signs of a heart attack. And for some reason, that just came to me. Back, chest, and arm heart attack. And I thought to myself, I'm 35, I'm young, I'm healthy.
And I just had a baby.
I just had a baby, healthy pregnancy. Like, this can't be it. But something was triggering me to go to the hospital. And I was going to drive myself because, again, part of me thought it wasn't a heart attack. And a coworker saw me in pain, in tears, hunched over. And he's like, I got to get you to the hospital. And thankfully, the hospital was literally 2 minutes away from my job. And when I walked into the ER, I told them, I think I'm having a heart attack, and they acted fast. And when I told them that I was postpartum 4 months, they kind of knew what the case was. They said they thought it was SCAD and got me in for an angiogram, and it was confirmed.
What does SCAD mean?
It stands for spontaneous coronary artery dissection, which means the coronary artery, the artery that supplies the front part of the heart muscle.
Show us on this
so where
model.
Kristen had her heart attack, she had it in the artery that supplies the front part of the heart muscle.
Okay.
You know, in older people, we usually have the heart attack where they have cholesterol in the walls of the artery, breaks off, and a clot plugs up the artery, stopping blood flow. In SCAD, there's an actual tear in the artery, and that slows down or stops blood flow because the tear starts to pull in between the layers of the artery wall, and it stops blood flow to the heart muscle, and a clot can also form.
Is this common?
Why do we see this in women who have either given birth or are in menopause,
So, like, to get the facts straight, it is probably the #1 cause of heart attacks in women under the age of 50, and the #1 cause of heart attacks in pregnancy. But it's not just about having a baby in terms of the women who have heart attacks. You know, it commonly occurs within a first few weeks after having the baby in the postpartum period. But it also can happen to women who have excessive stress. Think about it. She just had a baby. She's going back to work. She's dealing with childcare, getting everything together in her life, and this can happen. Also, extremely high blood pressure, or people who have a muscle problem in their artery. It's called fibromuscular dysplasia, where the artery is abnormal and is weak and is more prone to tears. Also, another cause is cocaine use. But I would like to remind everyone the best thing that happened to Kristen is she had a really good friend who got her to the hospital quickly.
What a beautiful person. Otherwise, you might not have made it. So what, did you have surgery? What happened?
So they got me into an angiogram, and they just placed 4 stents to put that tear back up, and since then I'm starting to feel a little bit more like myself. I am going for cardiac rehab, and hopefully that will bring my my momentum going and my confidence level back up to where I was before.
By the way, it's 2 months ago,
yes.
and you look fantastic.
Thank you.
And you're starting to feel better?
I'm starting to. I have my moments. There's days that I'm super exhausted, that all I want to do is crawl into my bed and sleep. I have 2 young little boys, so that's almost impossible, but I try to do my best every day, and you know, doctors say it could take up to a year for me to start feeling like myself and get back to my new normal.
At work also, you're going back into the same stressful environment, so how have you changed that in any way to be able to not get in the predicament that you were in?
Yeah, I just need to, I mean, I will be going back to work soon, but I just need to learn to take it easy and know when enough's enough, and you know, take my time off when it's needed. It's really about my health now and my family, and so that's going to be my main focus.
Doc, what are the chances of surviving? I mean, is she...
The statistics for women who have SCAD heart attacks are very good. The survival rate is high.
Good.
What's most important of the care in women who have SCAD heart attacks is not only taking the cocktail of medicines that we give them to prevent recurrence or heart failure symptoms or chest pain, but also going to cardiac rehab and dealing with the mental health issues. That's the #1 issue in people with SCAD heart attack, is to help the women deal with the stressors in their life and find better ways to handle and balance their work-life balance.
So is there any way to prevent having a SCAD heart attack?
Well, the way to prevent having a SCAD heart attack in someone who's had it is to take the medicine. We don't have traditional risk factors like high cholesterol, diabetes, or high blood pressure, or necessarily cigarette smoking. But it is one of the most important things a woman can do is get to the hospital quickly. If you have the sudden onset of tightness or pressure in the chest or behind the shoulder blades, don't worry about where in the chest it is. Call 911, and don't waste time looking it up, you know, Googling or reaching out to social media. You need to get to the hospital.
Yeah, I mean, your book is fantastic, The Complete Guide to Women's Health, Dr. Nieca Goldberg. You don't want to read this while you're having a heart attack, but you should get it before and kind of look it over and just see about your health and where you stand. Well, we wish you all the best, Kristen. Thank you so much for sharing your story.
Thank you for being here. Continued good health to you.
Thank you.
Dr. Nieca Goldberg, appreciate it.
Thank you, Doctor.
Good Day's coming right back.